Hi, welcome to You Can Do Medicine. My name's Tom and I'm a soon-to-be second-year medical student at Edinburgh University. Good to see you. And so today's video is about me working in the Royal Infirmary. Recently I started as a clinical support worker, just band 2, in the high dependency renal unit down at the Royal Infirmary in Edinburgh. And been doing that for a couple of weeks and it's been an amazing experience. Absolutely exactly the kind of thing that I wanted to do, and really rewarding. So I thought I would outline what it is I've been doing and what sort of knowledge that I've gained doing it as well. So, as a clinical support worker, your main roles are just, feeding, washing, stocking up, and ensuring that the ward just sort of flows nicely. You're also assisting any nurses that might need help with anything. And so it's a constantly sort of dynamic environment, and you're constantly, finding yourself sort of dragged in different directions. But, there's a good, it's a well-run department. It has a good pattern to it, a good flow. And with it being a high dependency unit, it's well staffed. In the high dependency units, there's one nurse per 2 patients, which is very different to on sort of general wards. And so there's a lot that you can learn. There's a lot of really unique cases as well. Obviously, some quite ill people, and so the level of care is and the level that the patient is needing from the staff is quite high. So yeah, general sort of shift pattern is we start by having a handover. That could be anything from 5 to 20 minutes. Because it's a high dependency in it as well, we get to sit in with the nurses. Clinical support workers in general wards don't necessarily do that. And so the handover will outline each patient, how they're doing, what's been the development overnight if you're working during the day, and what we're expecting for the shift ahead. I remember the first time that I sat in a handover, the medical terms flying around. I had absolutely no idea what they were talking about. It was, me being slightly dyslexic and, always having a bit of difficulty with medical terminology. So much of it just went over my head. And, that's an ongoing process. But the more that you do it, the more that you begin to understand. And the more sort of notes that I take, that I will then sort of research up on to see, what is that. A good example of that would be fistula. Something that I'd heard in some lectures during the year, and I said to one of the nurses, what is a fistula? And one of the patients had a really good example of it in their arm, so they took me over when there was 5 minutes spare, and showed me it, talked me through it, and explained that it's the joining of an artery and a vein, and it causes the vein to really sort of bulk up so that they have a good entry point for dialysis. Really interesting to see, and with it being the renal ward, there's a lot of patients that have it. Most of our patients are on dialysis. With it being renal, I thought it was just going to be kidneys, but it turns out that the renal ward looks after kidneys, liver and pancreas. Got a lot of transplant patients. One of the interesting things that I found out there is with the pancreas transplant, rather than them removing someone's pancreas and putting it in, they actually kind of macerate it and inject it in. And such is the amazingness of the body, it's able to sort of reconfigure itself and then grow into a completely new pancreas. This remarkable stuff. Whereas with kidney, it's obviously the whole kidney from a donor, and the liver will be part of a liver that will then grow out. Fascinating stuff. and every patient is different, and you know the team is really clued up. They really know their stuff. The nurses in there are just wizards. It's a real privilege to work with them. That aside, the other aspect of care, where you're looking after patients, you can see the real what's the word benefit of doing the care position that I had before I started working in the hospital. There's quite a lot of feeding we have to do with very ill patients, assisting feeding, washing, and a lot of our patients are bedbound. So, that aspect of it, maybe not the most glamorous, but really rewarding. You really are helping people, and seeing their story is a real good insight into the patient journey. It was something we really focused on in semester 1 of first year, and interestingly, the patient that I had as my case in the first semester was a kidney transplant patient. They had polycystic kidney disease, and they were actually in that unit. So that was really interesting, sort of piecing together the journey that they'd been on and actually seeing it in life. Another interesting thing I should say is that transplant patients, if they get any other illness, infection, they're usually brought into the high dependency renal ward because the chances are it's linked in some way. So they might come in with a completely different condition, but they're always checked to make sure that it's nothing to do with the previous transplant. So you're seeing a full array of cases, cardio illness, even neurological illnesses with patients that maybe had a transplant years ago, and that can be so insightful. Probably one of the more negative aspects of it, when I say negative, is the hours, 12 and a half hour shifts. Last week I probably pushed it a bit far. All the staff thought I was a bit mental when I said that I was doing 4 shifts in a row. I did Monday to Thursday, and doing the 50 hours in 4 days, you really are like waking up at 5:30, out the house at 6:15 so that I can get there, get changed and be in the handover for 7:30, and working right through to late. Long shifts. You get home, or certainly I get home, I just eat, do my washing up, get everything ready, and straight back in bed. There's no time for anything else. But I suppose that's setting me up well. That's the life of the doctor. There is a distance in my role from doctors. I've not really got to talk to any. The doctors mainly interact with the senior nurses, although, patient by patient, that you might be dealing with them. And there is doctors coming and going all the time, depending on what's going on. I was really lucky in that we had one patient who had a very rare illness, and loads of different doctors from different departments wanted to come and see her. Really just wanted to see what was going on, and I ended up sort of trapped in that room because I was changing the bed at the time. So many doctors come in that I couldn't get out, so I was just standing at the back watching the ward round with 8-10 doctors, and really interesting to see their take on it, and the kind of information that they look for from the patient, the way that they conduct themselves with the patient as well. Great. All of it's just so insightful. But I suppose the main things for me is that it's such a rewarding job. You know, truly helping people. Ultimately, that was when I left the pubs. I just wanted to help people. I didn't know how, and I now feel that I am. But also the steep learning curve and the just never-ending kind of, you know, what does that mean? You know, people kept on talking about hyperkalemia, and I was like, I should know what hyperkalemia is. You know, raised potassium levels. There you go. You hear it all the time. It's a good indicator of kidney function. So, just endless things like that that I can see will really help with the course ahead in becoming a doctor. So, if anyone else out there is contemplating it, unsure as to whether or not to go ahead, will it be worthwhile? Definitely, 100%. Couldn't recommend it more. It's been one of the best jobs I would say that I've ever had. I've had quite a few jobs, so yeah. Anyway, I'll hope to see you soon. Cheers. Bye.